Now we're going to cover adult CPR for the single rescuer for healthcare professionals. We've ensured that our scene is safe, our gloves are on, and our rescue mask is available with a one-way valve. And we're going to call out to the victim to see if they're responsive. Sir, can you hear me? Are you okay? They don't respond. So I place a hand on the forehead and I tap on the collarbone. Sir, can you hear me? They didn't respond to my taps and shouts. So I'm going to activate EMS, call 911, or call a code. If I have a bystander, I can tell them, hey, you with plaid shirt, go call 911 and come back. And if you can find an AED, bring it with you. I might need your help. If I have a cell phone, I could whip that out too and actually call 911 and put it on speakerphone and allow some help that way as well, or just access it through that technology. Now that I've gone ahead and done that, I can continue my assessment. I'm going to look for signs of normal breathing as I check for a carotid pulse. How do we find that carotid pulse? It's located between the trachea and the sternocleidomastoid muscle in the valley between those two structures. We're going to use the flat part of our two fingers and press moderately in that valley. I check for no more than 10 seconds, and I note that the patient is not breathing normally and they do not have a pulse. Now you might say also, well, what do you mean breathing normally? I mean, what does that mean? Breathing normally is someone who is breathing and oxygenating. Agonal respirations, which is basically like a fish out of water who's gulping or gasping for a breath, does not equal regular breathing or normal breathing. So to me, agonal respirations are no respirations, and there's no pulse, and they're unresponsive. So we're going to go right into CPR. Now let's talk about the technique of CPR. Right between the breasts, on the sternum, lower third of the sternum. We want to do a 2 to 2.4 inch deep compression, and we want to compress at a rate between 100 and 120 compressions per minute. That's about 2 per second. The other thing to note is that as you see me sitting on this bench, I would not stay here to do these compressions. It's A, going to be very difficult and exhausting for me, and B, I'm going to end up rolling over their chest, which does not adequately compress this hollow organ we call the heart. We want to compress that heart, which is sandwiched between the sternum and the spine, so that we can maximize that cardiac output. The second feature of that is that once we do our 2 to 2.4 inch deep compression, we want to allow for what we call full recoil. That full recoil means we come right back up to the neutral position before we do our next compression. And then lastly, as we stand over our patient, I want to come directly over the top of them with my elbows locked and using my upper body weight to do my full 2 to 2.4 inch deep compression 100 to 120 times per minute. So here we go. 1 and 2 and 3 and 4 and 5 and 6 and 7 and 8 and 9 and 10, 11 and 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I grab my rescue mask, seal it over the patient's face and nose, give them a full aggressive head tilt chin lift, and try 2 breaths. First breath goes in, chest rise and fall. Second breath goes in, chest rise and fall. Right back into the same location and 30 more chest compressions. I'm going to continue this 30 chest compressions to 2 rescue breaths until help arrives, AED arrives, or until my patient begins responding and breathing normally.